Hi, how are you?
Good, good. Hi, guys. I'm on with Dr. Mary Lupo, very world famous dermatologist from New Orleans, and on our Clean Skincare board. So, Mary, tell us how you're doing. What are you doing for your practice?
Well, the last time I treated a patient was on March 18th.
Wow.
Effective on the 19th, the governor of Louisiana shut down all non-urgent elective procedures, medical visits, everything from colonoscopies to non-essential routine skin checks, and naturally the cosmetic injections, which I specialize in. So I haven't treated a patient. I have, if you follow me, you can see, you probably have seen that I've injected myself and posted it to keep busy. But we are planning to open on May 1st. The governor has decided that we're going to be phase one of phase one, if you will, and doctors and clinics are going to be opened.
Very good. May 1.
Right. And
So,
us, we lost you. Where's your handsome face? I don't see it anymore. I see your photographs. I don't see you
oh gosh.
anymore.
Oh yeah, yeah. There we go. It's backwards. There we go.
Okay. All right.
Thanks,
Good. Good.
thanks for pointing
Um,
that out.
so what we're
So,
doing now is we are devising our protocols and getting our employees back to juggle our schedule. After all, we have about 6 weeks of canceled patients that we have to get new slots for, and ongoing demands for patients that want to come in. And we're going to cut our schedule by anywhere from 70 to maybe as much as 50%. And we're changing a lot of the protocols where we're not going to have anyone in the reception area at all.
okay, okay. So you guys better get in line to see Dr. Lupo. I know he gets people from all over the country and the world to come to see her. What about Cosmetic Bootcamp? What's the latest on that?
So the latest is it's looking like we're going to have a virtual meeting because Colorado was a hot spot.
Right.
And we don't think they're going to let us have the 200, 250 people that are in that. A virtual meeting where there's about 10 of us that actually go to Colorado, and we have like an hour or two a day where we have panel discussions and some sort of presentations and maybe even live injections. We're really working on the logistics now.
Okay. Okay. That'll be good. At least it's better than not having it.
Well, it's better than nothing. We want to keep engaged with our loyal following,
Sure.
but it also will be a learning experience for us. Maybe in the future, we can always have a virtual element to the meeting for people who can't manage to get away to actually attend our meeting.
Sure.
And it might give us the position to expand our reach because, as you know, because you've been to our meeting, it's very much a boutique meeting where we limit the number of people who can attend, and we only allow you to attend if you're board certified in an aesthetic specialty, so that the level of discussions is at a higher plane because the fundamental basics of aesthetics with the anatomy of the face and the musculature, et cetera, is already known by the attendees. And as you know, we're very active with our industry partners who support the meeting, and we actually allow them to come into our meeting lectures and live injections. And the reason we do that is we want them to learn what we're doing as clinicians so that they can help us help our patients because they have a body of knowledge.
Right. Great. Well, that's a good overview of your practice and CBC, which is a very popular aesthetics meeting. So let's jump over to your day-to-day life. I'm sure a lot of people are asking your opinion as a dermatologist on what to do with their skin during COVID, sanitation, sanitizers, etc. So give us your take on hygiene and importance of skincare and the way you approach it.
Well, I'm actually very glad that we're having discussions on hand hygiene and hygiene during flu season. Frankly, shaking hands in flu season has always bothered me. Okay. So, I would go to mass and I would actually within church lie to the people next to me. And so that I wouldn't have to shake their hand, I would say, I have a cold.
Yeah.
Because I didn't want to shake their hand in flu season. So I'm terrible in that way. I'm a germaphobe to a certain extent. I do think that hand washing, one thing I want to point out to people is you have to be careful what you wash with. And we'll get into a little bit more about CLN and how it's good. But more importantly, people need to moisturize also and replenish the lipid barrier. The hands have the fewest amount of oil glands and are the most prone to dryness. And if you get a lot of cracking, well, that's just another portal of entry for some sort of bacteria or virus. Now, usually it's going to be MRSA, staph or something. We don't know if COVID gets through cuts in the skin, but we'll learn a lot more hopefully about this virus over the next 6 to 12 months. And I think that that's going to be one of the most important things for the future going forward. I think none of us are petrified of the flu because we understand the flu. The specialists, the infectious disease people understand the flu. And although the flu can have fatalities, we understand it. This is clearly a different animal that we're dealing with this particular virus. Why does it seem to be so contagious, yet some people are asymptomatic and some people are put on ventilators and everything in between? And I really think it's the fear of the unknown that's driving a lot of the concern that we have around the country.
Yeah, yeah. So what do you actually use now in your protocol for hand washing? What is your routine?
Well, probably about 6 or 7 weeks ago, I posted a live video on my Instagram where I showed people how to wash their hands. And of course, I was using CLN. As you know, my use of CLN has very much evolved over the past, how long have I been using your product? At least 5 years, right?
Yeah.
So, initially I was recommending it to patients who had folliculitis, staph infections, recurring staph infections, few acne patients, especially back acne, but I also recommended it for the face to prevent bacterial resistance. If you were using, say, clindamycin or other antibacterial agents. I always try to have my acne patients and my folliculitis patients, as much as possible, use topicals, because systemic drugs, especially systemic antibiotics, are fraught with problems with the GI tract of our patients and bacterial resistance, et cetera. So I'm a big proponent of the use of non-oral antibiotic protocols for my acne patients. So I was using it for that. And then I had an epiphany. And probably, what was it, at least 3 years ago, I started using it for my patients before they got filler. Right. There was a lot of talk amongst aesthetic specialists a few years back about a problem called biofilm. And biofilm occurs when a bacteria can attach to an implant and replicate there and cause nodules. It can cause everything from an overt infection to maybe just a granulomatous response to the bacteria. So I started using CLN, and then it evolved even further, and I started using CLN and just wiping it off and not using water. And the reason I was doing that is down here in southern Louisiana, we have an organism in our tap water called atypical mycobacterium. Well, atypical mycobacterium has been in the literature for a number of years, causing problems with biofilms, usually in fat transfers, but theoretically it could occur with anything. Right. So what we did was we started having our last cleanse of the skin be a wipe down with the CLN and just wiping it off and not using any water at all as the last step of our protocol. And so lately what we've done is we've evolved now into using it in place of Purell as a hand sanitizer.
Yeah.
And so what we do is we put the smallest little amount. I don't know if y'all can see how much I have here because of the glare, but and you rub it in, and it takes about 20 seconds to rub it into the
So this is what
skin.
you're putting on there.
Right, exactly. Well, yeah. So the CLn body wash,
Yeah,
and
we got several.
what I've found is that it's much less irritating than some of the other hand sanitizers, and I'm very confident in its ability to kill viruses and bacteria. But I also think what we need to learn more about with the active ingredient, which is the sodium hypochlorite, is does it also have anti-inflammatory benefits, which might give it a protective effect that you won't get as much hand eczema if you're using this product as opposed to other products. Does that make sense to you?
Yeah. So two things. We have the product in the lab to check against coronavirus. We feel it's going to be effective against it because it has soap, and the coronavirus is it has a membrane. It has a cell wall where soap really breaks it down. And then as far as the anti-inflammatory effect, we do know that bleach baths are anti-inflammatory. It reduces NFKB. So from that we infer. And then on our 2 studies, we saw, significant reduction of inflammation and reduction of need for steroids. So there's a lot of evidence that, it behaves that way. We can't really say that. You can, I can't. But that's great to have that perspective from the field. Anyway.
So going forward, my recommendation to physicians who are reopening is to make sure that they have a sensible protocol that ensures, as much as we can ensure these days, the safety of your employees and your patients, and that you are documenting to your patients and sharing via Instagram or your Facebook pages or e-blasts what you're doing, because the way for us to get our country going again economically in a prudent way, being mindful of the virus, is for us as the first wave of being open here in Louisiana with the doctor's offices and the clinics. It's important that we set the bar, and when we have success and we don't have a spike because people are coming to us, then it opens up the next step, and the next step can open the hair salons and the nail salons, and then the smaller restaurants, or the restaurants that space out their tables, and that we can actually build upon the success that we have as physicians. And we are best equipped that we understand how important it is that we have cleansing and disinfecting that's effective for our patients and for our employees.
Great. That's great advice for sensible reopening of the country through the physician offices. And you guys are a hotbed in New Orleans, so I think everybody will be really watching what happens there. And so your leadership has always been awesome, and even more important now. So thanks for passing that along, and thanks for being my first Instagram TV.
I didn't know I was the first.
First on our clean channel, and I think this is your first too, right? Well,
it is. Yes. Yeah. Thank you for showing me where the buttons are.
Yeah. No, this is great. I mean, you're going to be awesome on this platform. I think it's a great way for us to communicate to other docs. On the other channel, I was on with a New Orleans-based infectious disease fellow last week, and we learned a tremendous amount from her. It's really fun for me as a physician to talk to people in other fields and just learn, for selfish reasons, and then the audience learns too.
Well, and if anybody wants to direct message me with any specific questions about how I'm doing something that might be very specific to your practice, feel free. After all, I'm not seeing patients right now, so I have time to answer some of these messages that maybe normally I wouldn't have time to.
Yeah, great. Thank you, Mary. You're awesome. So informative. I'm going to let you go. I think our time is up, and we wish everybody a great week. Okay? All right.
Thank you. Bye, everybody.
Bye-bye.